red light. Okay. Well, thank you guys for coming, first of all. I know you have busy schedules, and thank you to everybody who's filling in for you while you're here. This is an exciting program for me because I love to teach, first of all, but I also think it's really exciting for the rest of the organization to know kind of what Vet Services does. We're a very small part of this much larger machine, but we're also a pretty important part, so I want you guys to feel free to stop me or stop anyone in our department if you have any extra questions, especially in regards to this presentation, and be on the lookout for more because this is something that we're hoping to implement on a more regular basis to help everybody feel more comfortable with common diseases that we see in the shelter. My name is Devin. This is my personal email. Again, you can use that freely. It doesn't bother me at all. I love answering questions, especially on something I present. So if you hear that I made a mistake, please let me know, or anything like that. That would be very helpful for me too. Just a quick introduction of myself. I'm from Atlanta, Georgia. I just graduated from the UGA College of Veterinary Medicine in 2017, so I'm still pretty baby doctor status. I came right here after graduation and was the shelter med intern from 2017 to 2018, and then was fortunate enough to stay on as staff. So I love it here. This is me and my partner on our first summit hike, which was very exciting, so I felt like I obligatory summit hike photo here. These are our two special children. Kylo is just as special as he represents himself there. This is my old girl. She's been with me since before vet school, so she's put up with a lot. And then, of course, this is my first medical project, my three-legged tripod cat. So, yeah, I know. He's a cool guy. He's doing well. So today we're talking about retroviruses. This is just kind of a brief summary of what I feel like we can go through. But again, keeping in mind that if you feel like you want to interject at any point, please do, because this is really for you guys and a time for you all to ask questions and feel better about this. So we'll talk about what is a retrovirus, what common retroviruses we see here at the shelter, how we identify and manage these cats on the vet services side, our recommendations for preventing infection and managing infection, and then of course specific protocols here at the league, and then what to tell adopting patrons. I'd like to spend a lot of time on this, considering that's kind of where you all have your most experience with these points and facts would be most useful for you. So we'll just kind of breeze through this sort of more technical stuff. I'm a super nerd, so sometimes I get off on tangents about things that are really irrelevant to most other people. So hopefully I won't do that so that we can spend more time on stuff that you guys care about. But I think this is a face that we're all pretty familiar with here at the shelter. We got these nice, beautiful cheeks. So retroviruses are unfortunately something that we deal with a lot. They are among the most common infectious diseases that we see in cats. Retroviruses are they're very unique in that in order to complete their replication cycle within the body, they actually have to integrate into the DNA of the host. So if we can stop that process, then that animal has a chance to fight off that virus. But once it's integrated into the DNA, it replicates with our basic cells, our stem cells, and so it's there lifelong after that. This is just another. This is actually a blown-up picture of I forget what the technique is called, but these are the retroviruses that we see here in the shelter. I'm not going to tell you which ones they are yet. And then the good thing about retroviruses is that they're enveloped, and kind of contrary to what you might think, that's actually better because viruses that are enveloped, they have this protective casing, but that casing is really susceptible to our regular cleaners, hand soap, detergents, household cleaners, so they're really easy to kill in the environment. Viruses that are not enveloped, it's kind of like they have nothing left to lose, so they have to defend themselves. That's like a parvovirus. It's really challenging to actually kill that virus. So they are easy to kill in the environment and pretty easy to prevent, but once they're integrated into the DNA, they're there to stay. So we have two most common retroviruses here in the shelter. Anybody have any ideas?
How easily built.
Well done, Jim. Yes. So FIV is this little more rectangular shape, and then FeLV, or the feline leukemia virus, is this is more kind of like diamond shaped. FIV is feline immunodeficiency virus. It's very similar to HIV in people. That's where it got its name because of the presentation that we were seeing in cats and diagnosed this virus. Feline leukemia virus is named so because one of the more common associated diseases with this is leukemia. And then once we kind of studied these viruses more, we realized that they are quite similar. And they both fall into this retroviridae category. But that's why they are named as such. And we'll talk a little bit more about why we kind of lumped this term into that. Okay, so what came first, the cheeks or the FIV? Any ideas?
FIV came first.
And then we got the cheeks?
No.
All the way around? No. So we often associate FIV with those big cheeky tomcats. They've got that thick skin, like no scruff. They're usually covered in scars. You know, they came off the street. They're usually sweet as can be, you know, which is kind of weird. But basically, the reason why we associate FIV with these big tomcats is because FIV prevalence is most often found in male intact outdoor cats. But the cheeks are actually a secondary sex characteristic. So the cheeks are going to be there whether the FIV is there or not. It's actually driven by the presence of testosterone. So when we neuter cats at a young age, usually before 6 months, they're less likely to develop that characteristic because we mediate that testosterone level earlier on in development. So when we see cats coming off the street, they have the big cheeks. They're usually intact males or neutered later in life. And then they have a likelihood of being exposed to FIV, which then kind of made that correlation. So just a fun fact there. So FIV is most prevalent in male intact outdoor exposure cats. It is contracted through the blood. It's also found in other bodily fluids, most concentrated in the blood and then saliva, but it can also be spread through mutual grooming, sexual behaviors, and even urine and feces. So when a cat encounters another cat that is FIV positive, that fight is what exchanges the virus, and so open wounds and spread of blood is what contracts it and spreads it. Once it's in the system, it goes to the lymph nodes. Has anyone seen the movie Osmosis Jones? Oh, I highly recommend it. It's a great movie. It's a cartoon movie, but it's about Bill Murray is the main character, and his body is basically like a city, and so Osmosis Jones is a neutrophil, and so whenever the bad guys come into the body, it's like you watch Osmosis Jones and his team kind of fight off the bad guys. So that's kind of what I like to think of like with the lymph node system. It's a network of police departments, essentially. And so why I bring that up is because both of these viruses, FIV and FeLV, the main issue with them is that they suppress those lymph centers, and so they kind of take over our immune system, and that's what makes us susceptible, or makes the cats susceptible to other diseases. Similarly in HIV in people, though. It's a cool movie though. So overall, the infection causes systemic immune suppression. In advanced stages of the disease, it can also cause a neurologic disease, but we rarely see that. That's a pretty bad case. So how we diagnose and identify FIV positive cats, usually the big male tomcats with evidence of fight wounds or bite wounds, they kind of have a coarser hair coat. If we see them in the early stages of the disease, all of their lymph nodes are nice and big, and that's lymphadenopathy, where you can actually feel all the large lymph nodes under the skin. We rarely see that because they usually come in already having an established disease, but fever, anorexia would go with that acute presentation or just recently been infected. There's a high correlation between having this disease or this virus and having skin infections, particularly abscesses. There's a study that was a collection of abscess cases in various hospitals, and 12.7% of them were also FIV positive. URI, eye disease, UTI, diarrhea, gingivitis, and stomatitis. All of these are pretty common not necessarily a big deal type of infections on their own, but they're more likely to have these secondary diseases because the immune system is suppressed, and then it's also much harder for them to get over those rather common, easily treated diseases because their immune system is suppressed. Any questions about that and how we kind of identify these cats? This is a very sad but accurate picture of stomatitis. There's currently an 8% correlation between stomatitis and FIV positive cats. So not to say that every FIV positive cat is going to get stomatitis, but that if we see stomatitis, it's likely that cat has FIV.
What actually is stomatitis?
Great question. Oh boy. So it's an immune-mediated inflammatory process of the mouth, and quite
So it doesn't
frankly,
have anything to do with the stomach?
no, good question.
Okay.
No, the stoma is
Going down the
actually,
wrong road.
yeah, sorry. Stoma is actually a prefix that identifies the oral cavity. Gingivitis or immune-mediated gingivitis. These cases are basically the immune system is attacking the teeth. So the immune system is trying to get rid of the teeth. So when we see these cases, the only treatment we have that is actually shown to cause cats to be comfortable is removing all the teeth, drilling out the bone where the teeth were in contact with the bone, and then keeping them on either like immune suppressive or anti-inflammatories just to try and keep that immune reaction kind of at bay. Right now, we don't treat a lot of stomatitis here in the shelter. It's a pretty involved and chronic type of disease, but we're starting to treat more mild cases, even in FIV positive cats, in hopes that getting rid of the teeth, we can still give them a good quality of life. But this is a pretty advanced case. You can see there's a lot of breakdown and inflammation even in the back of the mouth. It spreads to the soft palate. It's very, very painful. And oftentimes when we see advanced cases, they are emaciated because they just can't eat. So it's correlated with FIV because this is an immune response to some part of the actual body, but it's still an immune-mediated disease. And so when we have FIV or FeLV and the immune system is suppressed, it's more predisposed to do kind of rogue things and attack things like the teeth. So this is a point that I think when I gave the presentation on Tuesday, a lot of the adoption staff was concerned about, because when we have patrons that are interested in adopting FIV positive cats, is this something that we need to warn them about? I would say yes. The recommendation from my standpoint, if you adopt a FIV positive cat, is routine dental care. The best way to prevent stomatitis is to keep the teeth as clean as possible, and any early signs of inflammation, just remove the teeth. And so since we have this correlation, I wouldn't use it as a point to scare somebody, but I would say it is expected that you will have routine dental cleanings in this cat's future, if not yearly. Maybe you could get away with every couple of years, but it would be something to absolutely keep an eye on. And we can talk about like the cost of that too, because a lot of people are like, well, how much is that going to cost me? Well, it's gonna be something to consider. Yeah. So we'll go through sort of the same pathogenesis of feline leukemia virus. Luckily, we have seen a significant decrease in the prevalence of feline leukemia virus, FeLV, in the last 25 years due to vaccination and testing. Unfortunately, there has not been a decrease in the prevalence of FIV since it was identified in like the late 80s. So probably because we still have these male cats outside and they easily spread through fighting. FeLV, we test for in the same manner as FIV. The vaccinations that are available for both of these diseases, FeLV is a little bit more effective at this point. There's still a lot of research going into those vaccines to make them better, but we'll talk about those vaccines too and when they are available to people. So still in a recent study, 2 to 3% of the cats found in the U.S. as a feral population were positive for FeLV, and then 30 to 38% of unwell cats entering shelters and clinics were positive for FeLV. So we do see a lot of morbidity associated with this virus. This virus,
Is that usually all outdoor cats that have been outdoors primarily too?
for this study, I don't think so. I think it was shelters and privately owned clinics that were screening for retroviral status. It is definitely more prevalent in an outdoor population, though. It's spread through saliva. It's most concentrated in the saliva of cats as opposed to blood, but it is also spread through other bodily fluids and then milk. So kittens that are nursing off of a mom that is FeLV positive are at a really increased risk of contracting that disease from mom. And then there's even a possibility of getting it in the uterus, and that likely results in abortion of those kittens. If not, then they're likely to be born with an FeLV positive status. So our kitten population is definitely at the greatest risk because of grooming and nursing. And these two cats are just, they just love each other. It's so cute. Okay. So FeLV as opposed to FIV does have a little bit more complicated pathology once it enters the body. It is more likely that our immune system, or Osmosis Jones and his police buddies, are able to fight off this disease rather than FIV. So we have various stages of viremia, which basically means virus in the blood. So once they are exposed to it, they have the chance to mount an effective immune response and build an immune system against it, and keep it from integrating into the DNA. So at that stage, they may test positive, but they can still clear it. Secondary viremia is that it is within the body and it does replicate at the level of the stem cells, but our system is able to keep it at bay. So they may not be clinical, but they are still likely to pass it on. And then the lifelong persistent infection, so they are positive for it, they are shedding it, and they are likely to become clinical for it. This is something that you guys probably won't encounter unless you see a release in that says this cat tested positive for FeLV and then tested negative. We are considering this negative at this point, but it's still something to be aware of because that means that that cat was exposed to the disease and did mount an immune response to it, but may still have the potential to shed it or spread it depending on at what stage that cat is in. So right now we are not moving along FeLV positive cats because of the associated morbidity and mortality of this disease. However, we have gotten some feedback from the community that they are ready to take on and care for these cats, which is really awesome. So it's something that we're looking into from a shelter standpoint. If we can find the right candidates that are FeLV positive but otherwise super healthy adoptable cats, where that would fall into our adoption process. So we are, Dr. Monroe, Camilla, and April, they're working on putting together an SOP releases and protocols as far as moving these cats forward, which is really exciting. I think it's something that, again, being here in this class is great because you can help educate other people on the floor and say, you know, yes, I learned about this disease. It is really scary, but you can give this cat a great quality of life. And so, so it's good. It's good that we're looking into that. So you may see releases or tests and get confused about what that means as far as these FeLV positive cats if we do move them forward, but we can clarify that for you. FeLV is tricky because they usually, not even may look normal, they usually look normal. When we see them as veterinarians, they usually come to us with pretty nonspecific signs of disease, loss of appetite, progressive weight loss, fever, poor hair, coat conditions. They are also associated with abscesses and other secondary infections. But the challenging part with FeLV is that this usually means that something like this is in the works. FeLV has a high correlation with cancer. Cancer, in a nutshell, is just overpopulation of an abnormal cell type in a rather normal tissue. It arises from a normal tissue, it over-replicates, and then it eventually leads the body to stop doing its normal bodily stuff. So FeLV suppresses the immune system, kind of kickstarts something else, and something goes rogue, and then we're more likely to develop a tumor and eventually a cancerous state. So leukemia, lymphoma are more commonly associated with cats that have FeLV. Leukemia is originating in the blood, and lymphoma is originating in the lymph system, or in the immune system itself. Immunosuppressive conditions, basically red blood cells, clotting blood cells, and white blood cells are all suppressed. So it's not really a whole lot left. So that's kind of what's pertinent for us in managing and identifying these cats. So we'll get a little bit more into what you guys can talk to patrons about, and sort of what you feel may be more pertinent in your personal experience with these cats, so particularly FIV, since we have those on the floor currently. So living with FIV, so once the cat gets home after adoption, these are going to be the things that we tell people that are most important. The age of infection will dictate clinical outcome. It depends on when this cat was infected, how healthy that cat was at that time, what sort of support system that cat has. That will determine how long and how good of a quality of life that cat can have. On average, 5 years is the life expectancy for a cat diagnosed with FIV. Or not. Yeah?
Can you determine the age of infection, like when a cat comes in?
Good question.
On what you see or no?
Not really,
Okay.
no. So if we were lucky enough to catch a cat with a high fever, all the lymph nodes are swollen, and he's tested FIV positive, you could guess that that wasn't the inoculating stage where that cat is reacting to having that virus for the first time. But that's really rare. We rarely catch them right after they've been exposed or right after they've been infected. Otherwise, there is no way to tell. And this is, again, this is an average. So average lifespan at the time of diagnosis. So there's a variable, because you could diagnose one cat and it's been infected for 5 years, and maybe that cat lives another year or two, as opposed to catching a cat that was recently infected, maybe that cat lived 10 years. So it's an average. The most important part about this estimate and prolonging the life expectancy is supportive veterinary care, making sure that your cat is otherwise supported systemically, so that that virus doesn't take over a susceptible immune system or immune cat. The risk of death comes with secondary illness, not necessarily the virus itself. It's a progressive immune dysfunction, so supporting the cat, and maintaining the appropriate lifestyle. If you have neurologic disease, obviously that cat needs to be inside, but any cat that is FIV positive, we recommend to be indoor only. That's to protect that cat from exposure to other diseases, but also to protect other cats from getting FIV. Spaying and neutering, especially with the male cats, when we neuter them and take away that direct supply of testosterone, they're less likely to roam, less likely to have those mating behaviors where they want to go out and find other cats, marking or territorial behaviors that may promote or instigate fights with other cats, and then decreasing the risk of spread through sexual behaviors. And then frequent veterinary care, and that's usually where you guys get the how much is it going to cost me question. FeLV is a very similar recommendations as far as living with a positive cat. We do find that the average lifespan is actually less. FeLV, it's only 3 years right now. It can be much longer depending on the support that that cat has. Again, indoor only, monitoring for subtle signs of not doing well, like decreased appetite, decreased weight. Do recommend keeping them separate from other cats because mutual grooming is the primary way that it's spread. That being said, yeah?
Are there healthy cats, or if you happen to have another FeLV?
Okay, yeah, that's a great question. Yeah, I wouldn't be opposed at all with living with another FeLV cat, because even if one or two of those cats is at a various stage of viremia, they both are exposed and have the appropriate response to it or have the disease. Other healthy cats is where, with FIV or FeLV, my professional training says don't let them interact with healthy cats. But I do know that a lot of cats have been exposed to these diseases and have an immune response to them. If we can keep an FIV positive cat from fighting with other cats, then the risk is really low that that other cat would get it. So slow introductions between cats, if one of them is a retrovirus positive status, and then closely monitoring your healthy cat to ensure that that cat does not pop as positive at some point. There are also vaccines available. So if you introduce a positive cat to a negative cat, that negative cat, you should ask your veterinarian about getting them vaccinated and protecting them from getting that disease from the positive cat. And we'll
Does
go-
that vaccination have to be repeated yearly or something?
Yes, it does.
So it becomes part of the.
It becomes part of their, yes,
annual
exactly.
exam, Okay.
Yep. So let's talk about the vaccines that we have available for both of these diseases. We have FIV and FeLV vaccines available. I would guess that routinely your veterinarian will have the FLV vaccine, but probably would have to special order the FIV vaccine for you. And there's a particular reason for that. So first off, the FeLV vaccine has a lot more research behind it as far as its being more efficacious in preventing the disease. And so it is readily available. We offer it through Meow Solutions and at SVH. You have to test your cat first, or it's really recommended that you test your cat first so that you know their retroviral status before vaccinating them. It's a lifestyle vaccine, so it's not required by law, and it's not part of our core vaccines that we have, that we give here in the shelter too. But it is a really good idea if you have a positive cat at home, or if your cat is indoor-outdoor and you know that cat may be exposed.
So why do you recommend testing first before you get the vaccine? Is there some danger if they're positive and giving the vaccine?
No, I wouldn't say there's a danger to it. I think it would just be
Waste money.
a waste of money, and you may have the false impression that your cat is protected if it's actually infected. And so I always think, I recommend that everybody knows the retroviral status of their cat, especially if they've been adopted or if they've been exposed to other cats. Again, it's a lifestyle choice, and it's more information for the health of your cat. But if you do want to protect your cat from FeLV, I guess I would recommend knowing if it was positive or not at the time of vaccination, so that you know that you're actually getting a full protection from it. Yeah.
So we're in an interesting situation in our household.
Yes, I actually heard this story.
Well, in many ways.
In a nutshell, we had 12 cats.
Yes.
One cat who was 3 years old, who I had fostered since, tiny, broke with FeLV at age 3.
Mhm.
We first noticed weight loss, and then he was a little bit lethargic, and then he's a blue-eyed cat, and his eyes our color started to get less and less, and then your eyes were really blue, and that went up. And this happened very quickly.
Yeah. Wow.
Within a week, right? Something is going on
Wow. Yeah.
with Diego. So I called my vet, took him in. By then, he was jaundiced, and the vet said, "This is serious.
Yeah.
I don't know what it is, but this is serious."
Yeah.
He had tested negative for FeLV when I adopted him.
Okay.
And so she went back, ran full blood work, and then saw that the blood work was just totally whacked out.
Okay.
Liver was just off the charts. So she went ahead and tested him for FeLV, and it turns out he was positive.
Okay.
So she came back to us and said, "He's FeLV positive." And we both just went, "What? He can't be. He was negative. I've had him since he was this big.
Mhm.
He's been perfectly healthy for 3 years." Picture of a beautiful cat.
Yeah.
Coat looked great.
Yeah.
Everything looked great until the last week.
Wow.
And then bam. So her recommendation was that we went ahead and euthanized him because he was crashing so quickly.
Sure.
So then we have 11 cats.
Right.
Who lived with him for,
Lived with him for, his whole life.
Yeah.
Only one cat was younger, and he came in as a kid, another foster failure. And
all of our cats.
All of our cats.
Sounds better than Lucky.
Yeah.
That's your middle name, Christ.
And Simon was a year old. Well, he and Diego were this entire life. Diego took Simon on as his best friend,
Yeah.
and they were always grooming each other.
Mm-hmm.
So we looked at each other and went, oh, shit.
Yeah.
And that's basically what the vet said to us.
Yeah. Yeah.
You guys are in
Literally.
a tough situation.
Yeah.
So we started testing all of our cats one at a time. First we did Simon.
Okay.
He came back negative.
Okay.
Like, okay, this is a good start.
Yeah.
Tested all the other cats, all tested negative.
Great.
Crossing our fingers. So we
Yeah.
went ahead and had Simon vaccinated,
Okay.
and he's due for his booster pretty soon.
Yep.
But our vets at the time over at Evans East,
Okay.
I talked to Dr. Bixman about it, and he goes, yeah, we're finding that a lot of these cats can actually fight it off, especially if they're overall very healthy.
Yeah. Okay. Good.
So we've started adding Fortiflora.
Okay. Yeah.
It's like
Supporting them
anything-
any way you can.
Anything we can do to just give them a little bit of a boost.
Yep.
So now we're in the holding pattern
Yeah.
of everybody in the house is negative. We've chosen to be optimistic,
Yeah. Well, good. Good.
but we know that something could happen at any time.
Yeah.
But in the meantime, we're like, okay, we think we should be a case study.
Yes.
Because they were all DFL cats, means at some point they all tested negative.
Right. Yes.
And
Mm-hmm. Yeah.
now
That's
they tested
interesting.
negative twice.
And how old was Diego tested when he was, I guess, a kitten? Because you had him.
When he
Yeah,
got- when he
2
was-
months.
Okay, yeah, gotcha. That may be what it is as well. If he tested negative and he was that young, he could have been either exposed to it and it was before he was at the point where he had tested positive. That would probably be my guess, because or one of your cats, well, but they all tested negative, could have been shedding it at some point, or maybe even a cat that you had as a foster or
Well,
something.
we foster, but our fosters are isolated.
Oh, okay, good, yes.
I have his foster room, I have my foster room. They never
Good.
meet. They're all indoor only. We do have a catio, but they,
Cool,
nobody can get into.
right,
Fighting.
sure,
We really have very minor interactions in our household. An
Yeah.
occasional scratch, but we've never had a major
sure.
fight that required a vet
Okay, yeah.
visit. So, we're,
Yeah, well, and I think it's good to be optimistic, I agree, I think that a lot of cats can fight the infection. That's kind of why FELV is so tricky for us here in the shelter, is because when we see a positive test, it's really hard to know. Is this a temporary positive? Is this a true infection? Is this, has this cat been nursing off its mom and still has mom's, antibodies and stuff in there? But once they have that positive status, that would be, I guess, where you guys are at, and I would probably, retest your cats even in 6 months.
that
Or
was
so.
my question, is how
Yeah.
often should we retest? And should we retest everybody or just the
The
youngest?
highly exposed,
Because
yeah,
everybody else in the household is like 5 years and older.
sure.
Um,
I guess I would say probably retesting Simon,
Simon.
yeah, in 6 months, just to make sure he's still negative.
Yeah,
And then maybe in a year, and if you get all those are negative, then I would probably be confident in saying he's protected, especially now if you have the vaccines on board to help with his immune response to that. But I think you're a good case study because it shows how nasty this disease can be.
yeah.
Once they aren't able to keep it at bay, the rest of the body comes to its presence.
Yeah, our vet said basically he had this, raging liver infection
Yeah.
of some sort.
10 times the maximum normal bilirubin.
Wow. Ew. I'm so
So-
sorry you guys had.
So vaccinations,
Yeah,
I mean, the question is, well, wait, they were already all been exposed to it from him. On the other hand, somebody could be a carrier, right?
potentially, but that cat should be testing positive even if he's a carrier.
Okay, that's other
Yeah.
question.
Mhm. Yeah, that cat would test positive. Yes, because, which we'll talk about here, the different types of tests, what the two tests actually are looking for is different. So the FELV vaccine, it's more effective right now. A lot of vets will recommend it if your cat goes outside or if it's a lifestyle choice for your cat to be exposed to other cats. the FI vaccine is available. It's not necessarily recommended and it's not required. And that's because at-risk cats, we do want to protect them, but the best way to protect them would be to keep them inside. And then if you have a cat that you vaccinate because it's an indoor-outdoor cat, the trouble is, if this cat is vaccinated for FIV, it will test positive for FIV. And so if somebody finds your cat and takes it to a shelter and that shelter tests it, that cat is now FIV positive because the test cannot distinguish between a true infection or having been vaccinated. And so that no euthanasia decision should be made solely based on the retrovirus status of a cat, but it is definitely going to take a part in the decision if that cat is otherwise unwell. So if your vet does offer an FIV vaccine, if that's something that you choose to protect your cat against, that's great. Protect them, keep them inside, but make sure that you do a tattoo or a microchip ID that a shelter can universally pick up on that says my cat was vaccinated for FIV, and that way we know.
So that's not for the FeLV vaccine.
Correct.
What is there currently a universally acknowledged tattoo or? I mean, how?
No,
how do
not
you
that I know of. The tattooing, it would probably be like a spay-neuter tattoo, but probably the most effective way to be to link it to his microchip. So get him microchipped if you get him vaccinated for FIV. And then the microchip, you can pretty much add whatever information you want to the microchip.
Oh, I didn't know that.
Yeah, not just his
I didn't
name
realize
and
that.
address and phone number. You can put loves to eat Friskies, you know, but definitely put
I
his
didn't
vaccination
realize
status
that.
on
About
there.
the microchip.
Yeah. Sorry?
Do they have to be rechipped?
Nope, you can, if you can access the, so when the microchip is scanned by the scanner, it pulls up a system, kind of like a database. And there's different types of scanners and different types of microchips, but most shelters, I think, are stocked with the universal scanner, meaning that it's equipped to pick up on all available commercial microchips. And so that database should pull up either a link or the information itself that can go to whoever administered the microchip, that company, and then that's where you would find all the information. So you can link the information to that.
So any of the